Hi, I'm Candy Hilton. I'm the house manager here at Grace House Akron, and today we're going to talk about medication, training, and administration. So before we get into the demonstration of how you go about administering medications to residents, I want to go over a few safety tips and let you know what are things that just are non-negotiable at all times. So the first thing is you need to make sure that you're only medicating residents one at a time. Never take medications out for more than one resident at a time. So when you come in for your shift, you want to make sure what meds need to be given for each resident at what times on your shift. And at that time that it's due, you go in and make sure that you get all the medications out of the pill box for that particular time slot. And then you want to make sure that you are doing one resident at a time. When you are done and you've administered that medication to that resident, then you can come back to the med room and go to the next resident. The second medication safety tip is all narcotics should be counted before you give any. So we all know that you do the counts before and at the end of your shifts. But when you are giving a narcotic such as oxycodone for as needed purposes, you want to make sure that you're counting those medications before you give and take a dose out of the supply that is in the silver lockbox. So for instance, if a resident said they needed something for pain, it's every 3 hours is needed, and you look on their sheet and you see, oh, they had a dose at 8 a.m., it's 11 a.m., they can have another dose. Before you, when you go in to see that they can have that dose, then the next step would be to go to the silver lockbox, get the pill bottle out of the lockbox, count what's in that pill bottle of oxycodone, and say it's a start of 12 pills. You know that that is what should be in that pill bottle. So you check to make sure, and then you can take the dose out for the resident. Next thing is making sure that this medication room that you go in and out of all day, if you are not in the room, you don't want to leave the door open. As long as you're in the room, it's fine if this door is open, just like we have a nurse here right now. However, once she leaves the room, you want to make sure that you close the door. And that's for the safety of our residents. We get a lot of visitors, we get a lot of volunteers that come in and out, lots of traffic that comes in and out of the house at all times. So making sure that this door is closed is a way to keep everything and all the medications that we have in there safe. The next safety tip would be making sure that the medications match the sheet. So what I mean by that is this is our medication book, and you all are familiar with this. When you get ready to go to give a medication, say it's a scheduled one that is on our blue sheets. You go to the room number, you make sure that the medication sheet or record is showing the name of the person, Mr. John Stewart, his date of birth, diagnosis, and allergies. And at that point, you know already that you have 6 a.m., 1400, and 2200 meds that he is time to take. Whatever you're on that shift, if you're working day shift, you're responsible for the 1400 pills. So making sure that you are looking at the proper date. Today is the 23rd. So today at 2 o'clock, we're going to give him his pills. So you want to make sure that everything is matching up as you are looking at the pill box. And we'll go through that a little bit further in the demonstration. Now that we've kind of gone through some of the major tips, I want to explain, as you all are probably familiar, You just saw the blue medication sheet for Mr. Stewart. If for some reason Mr. Stewart does not end up taking, say, his 1,400 pills, he may be too lethargic and not waking up and alert enough to take his pills. At that time, you want to circle the time and the date that he would have taken that dose, and on the back, it's at that point that you write the date, the hour, the time, your initials, the medications, which you would just put 1,400 pill box because you're not required to know what those meds are, and then the reason why he did not take those. You have to make sure that you are doing that, so then when the nurse comes in to see the resident, he or she will better understand why medications were not given. The next sheet that you all are familiar with is our white narcotic med count sheet. So this is the sheet that you are responsible before and after shifts, at the end of shifts, to do your pill counts, but also if a resident was in need of any medications, it's on this sheet that you would minus whatever that dose is. This particular example, oxycodone 20 milligrams is equal to 1 tablet. So if this resident needed a dose of this and it's every 3 hours, then you would just put the start amount. The amount given would be 1, and then the remaining amount would be 3 at that point, since you started out with 4. Make sure that you're putting your initials. And when you're doing your pill count or med counts before and at the end of each shift, the person that's coming onto the shift would be initialing in this column because they're coming on, and the person that's leaving the shift would initial here. Please make sure that you are doing that and not doing it the counts before or ahead of time. You have to write this out as you are doing your counts. The next sheet would be the pink sheet, which at this point, Mr. Stewart doesn't have anything that is non-narcotic, but also as needed. So this would be the sheets that we would use if a person had something like Senna ordered every 8 hours as needed, or Tylenol, or albuterol, aerosol treatments. Those things would be listed on this area so that you could still give it on an as-needed basis. It would indicate per medication how frequently you would be able to give that. Another big thing that we want to make sure when you're in the medication room, and this is very important, this is at any time, whether you are getting medications during your shift for a resident, or especially when you are doing med counts before and at the end of your shift, no cell phones should be in the med room. They can become a distraction if someone tries to call you, or if you are doing count, it can distract your focus so that you're not focusing on the count when you're doing that. So just be sure that when you're in there, you're giving what you're doing your undivided attention and taking your time, so that the hope is that errors would be decreased and we would be able to make sure that our patients are getting the safe care that they are deserving of. This is the demonstration of what you would do as far as when you first come in for your shift, after you've gotten report and you've done your med count and all of that and you're starting your shift. The first thing that I would recommend after all of that is done is to come to your medication, to the medication book, and go room by room and see for your shift what medications you need to give at, during your shift for each resident. So as you are going through, just making sure that you are writing down the medications that are due for your shift. I think everyone is familiar with the military time that we use and what times would you would be responsible to give medications for. So this particular resident has no meds during day shift, so I don't need to do that. And then I'm looking through and I'm seeing, okay, I came in at 7 this morning, so 8 a.m. I am responsible for, and I'll put a 2 there, and I'm responsible for 1400. I'm responsible for the patches. That's all at 8 a.m. So I'll know to look and see that those are things that I have to give. And so forth. Room 3, room 1 did not have any for me. Room 3 is also at 8 a.m. and a 1400. Okay. And so forth. So this is what is recommended for you to do at the beginning of your shift so that you know who has what times that needs to be given their medications, what rooms. So for this example, even though this says 1400, because 6 a.m. would be on night shift. They would give, the night shift caregiver would give that particular medication before she leaves for her shift. So I'm gonna go down to room 6 and say, hey, I have a 1400. This is our example for today with Mr. John Stewart. So we're gonna go through and show you what that looks like. So I am going to take this book into the med room with me. I'm gonna have it in front of me, so then when I get the pill box out, I can make sure that the name that's on the pill box is the same as what's on the sheet. And the times that are on the sheets are the same as what's on the pill box. So as you can see, we time each pill box will have the times just at the very beginning on the first row here, but you know that time goes straight across. So this is Sunday through Saturday. Today, we're gonna pretend like it's Monday, okay? Today is really, it's really Friday, but we're gonna pretend like it's Monday. So I'm gonna say at 1400, it's Monday. I wanna make sure that I'm looking at the right day and the right time. And so I see that 1400 is here and here. So at this point, I'm gonna grab a pill cup. I'm gonna take my 1400 dose out and dump it in. Make sure I close this back up. And put this back in. Now the med room door was open already because our hospice nurse is here, but if she were not, what I would do is make sure that once I leave the room that I'm closing the door behind me. So that way no one can get in while I'm administering this to the resident. I will not sign off on this until after I take it down to Mr. Stewart to give to him and make sure that he's taken it. Then when I get done with that, I'll come back to the med room and sign it off. So let's go do that. Shoot, I can't put the drink. Hi, Mr. Stewart. How are you?
I'm all right.
Good. You feeling okay today?
Pretty good.
Good, good. I have your 2 o'clock pill right now. Do you need some water? Do you have anything that...
I have a drink.
Okay. Okay, I want to make sure that you take that and that it goes down okay without any issues. Okay, all right. Thank you so much. Do you need anything else right now? Are you having any pain or discomfort or?
I'm all right.
Okay, if you feel like anything comes up, just let me know if you think you might need something for pain or shortness of breath, okay?
All right.
All right. So that is what you do. And now we're going to go back to the med room and make sure that we sign that off so that other people that go into our medication records will know that that particular dosage at that time was given. Make sure that you have the right date and the right time, and then I'll put my initials that it was given. And this would be the same with the medication for oxycodone, like that's on the medication or the med count sheet. So Mr. Stewart, it's been 2 hours later, and he put his call button on and said, hey, I do need something for shortness of breath. So I'm gonna go and give him some oxycodone because he can have it right now. You have your silver lockbox. And side note, when you're doing your med counts at the beginning and end of each shift, make sure that you're taking one lockbox out at a time to count. Don't have multiple ones on the counter because that's when medications can get mixed up and put in the wrong lockbox for the wrong resident. So I'm gonna go in and say, okay, Mr. Stewart, his name is here. The oxycodone 20 milligrams immediate release is 1 tablet by mouth every 3 hours. I see that all of that is matching up for pain or shortness of breath. So I'm gonna now make sure that I am counting what is in here before I take a dose out. Okay, we got 4 pills, and that is what is indicated on the record here. So at this point, I am just writing, all I'm writing at this point in time is the date, the time. We're just gonna say 1400. We started out with 4. I'm taking 1. And then I'm not gonna actually sign this off until after I give it. I'm just merely writing in what is left in the bottle once I take it out. Ooh. Okay, so there's 3 left. Gotta make sure that I put all of that back in. I'm gonna leave my book in here and make sure that this is shut up. Okay. Oh, Mr. Stewart, you wanted something for pain, and it's time now, so I wanted to make sure that I bring that down to you.
I did. Thank you so much.
You are so welcome. So this is your oxycodone. It'll help with the shortness of breath as well. Okay.
Thank you.
Okay, you are very welcome. You need anything else right now?
I'm all right.
Awesome. So the last step for this will be going back to the med room and actually signing that I gave it. And that's how we use our medication sheets. If you have any questions, please let myself or Holly know. Before I close, one thing that I do want to mention too is making sure once this sheet is filled out completely, that all of this information at the top is then put on the back side. If there's any adjustments in medication dosages, then we would just be writing a whole new sheet out. But if it is the same and nothing has been adjusted with that, all of this information at the top would need to be transferred over to the back here. Okay.